So foreign nationals in South Africa are once again at the centre of a debate over access to public healthcare services. This comes after anti-migrant groups, including Operation Dudula, blocked undocumented migrants from entering clinics in cities like Johannesburg and Durban. The South African Human Rights Commission has condemned these actions, saying the Constitution guarantees healthcare access across the board, regardless of the immigration status. For more on this now, we're joined by the Wits School of Governance Professors Alex van der Heever. Prof, thank you very much indeed for joining us. I mean, as we're speaking to you now, the acting mayor of Johannesburg, Kenny Kunene, is actually out on a raid in the Johannesburg CBD, in fact, in Randburg. And at that raid, they're disconnecting, illegally connected water, electricity, buildings have been, hijacked there. But first, I want to talk to you about, what's your reaction to reports of foreign nationals being turned away from public healthcare facilities in cities like Johannesburg as well as Durban?
Well, I think that the South African Human Rights Commission is entirely correct in saying that this is totally inappropriate. And it's not only about saying, well, we must comply with our constitution. It is about making sure that if we are basically rationing or managing the financial integrity of our public health resources, it should be done in a manner that is fair, equitable to everybody concerned. It must be consistent with with human rights requirements. So the Operation Dudula and people like that have no business interfering with patients trying to access healthcare services. They should be held personally liable for anybody who is harmed. I mean, they should be, it's criminal and potentially incurs a civil liability as well. They should be absolutely stopped. They have no business doing that. So the question is why government is so weak in actually dealing with Operation Dudula.
Yeah, and I go back to a time where, in fact, an incident like this had taken place. You would recall in Limpopo, Mayor Poppy Ramathuba, she'd been lambasted for a similar conduct within a healthcare facility over the basis that some people are arguing, Prof, that there simply isn't enough to take care of South Africans themselves, and the strain that is being put on healthcare facilities sees South Africans who should have access to adequate health care not receiving that due to the strain on the system. Who should be taking responsibility for that?
It's entirely government's responsibility to ensure that the management and the financial integrity of the health services, both in Limpopo, KZN, and Gauteng, and nationally, is managed effectively. You do not transfer that risk onto individual patients. That's why it was completely wrong for the MEC for Health in Limpopo to in any way target a vulnerable patient from a position of power. And what this amounts to potentially is scapegoating foreign patients to hide and disguise the massive mismanagement of public resources. So in the case of Gauteng, if the provincial government was so concerned about resource management, you'd have to ask why they had to return funds that were allocated to them to eliminate the backlog in cancer treatment. They didn't spend the money. It's taken 5 years for Charlotte Mpheke Hospital to be fixed in that time from a fire that was caused by arson, which they failed to investigate. In a period of 5 years, you could build an entire new academic hospital. You have ghost contracts that are clearly operating within many provinces and also within Gauteng. And the question is, are those eliminated? How much money are we losing there? We've got the unresolved corruption at Tembisa Hospital. We've got Kempton Park with security contracts that have been running into the millions every year in a closed hospital that hasn't actually been properly secured. And one can go on and on and on. That's gross mismanagement and the waste of public resources. And now to say, well, the problem is foreign patients using public facilities. And it's also important to note that it's government's responsibility to ensure that if there is a cross-border flow of patients from within the region to South Africa, that is resolved on a multilateral basis with those countries, because we're in a position to actually bill for those services, but not the individual patients, but those countries. Now, where is government? Has there been any news report about government at any point engaging in multilateral discussions to deal with cross-boundary flows? They can't even raise an invoice against these patients to actually work out how much they cost. So there's actually no technical information on the resource utilization of foreign patients. There's always just some obscure number about, well, most of them are foreign at this particular clinic or that hospital. Well, what's the actual evidence? So the issue is that if there were evidence, if they were able to actually work out the individualized cost, they would be able to work out an agreement regionally on cross-border payments. But government has done nothing for 30 years, nothing. And now to say it's the problem of those patients, that's nonsense. And I think that we have to avoid allowing opportunists like Operation Dudula to become a political distraction from governance failure and a failure to do the basics in running a public health service.
From a public health perspective, I mean, what are the risks of denying undocumented migrants access to medical care, particularly, as I indicated, in these overstretched health systems, which government is supposed to deal with?
Well, firstly, they would probably incur liability because at this point in time, it is illegal to do that. But it is appropriate to ensure that those services are funded from somewhere, but not from those patients. So the implications can be severe for those particular patients. But it's unclear whether or not their utilization of public services is the cause of the difficulties in the public health system in South Africa. There's no evidence that they can't be stretched to treat these particular patients, but it is right that they are appropriately funded. But that's got nothing to do with those patients. It's just wrong and abhorrent to actually target those individuals who are the most vulnerable of the vulnerable. And, the question is, what is the right way of handling the situation? The right way is to make sure that we've got government cooperation in dealing with this, not to prejudice these individuals.
Prof, that was my next question. I mean, what should government and civil society be doing? What role should they be playing in balancing, these constitutional rights with the realities, of migration and limited public service?
So the issue is that we operate within a regional context. We've got porous borders. People are going to cross these borders. You've got people who need healthcare. You've got where South Africa itself has arguably contributed to these cross-border flows by actually supporting the regimes in Zimbabwe and elsewhere that have failed their population. Their health services are collapsing as a consequence. So that cross-border flow is both a consequence of South Africa's indulgence, basically, of elections in these particular countries that has caused the economic failure and the public system failure and deep corruption that has caused these cross-boundary flows. We are partly culpable for what's happening in the region. The second issue is that we do have a role to play in setting up a multilateral agreement on how to deal with the funding of unavoidable cross-border flows. And that way those countries share in paying for our public health services on a basis that can be audited and accounted for. Now, it's for South Africa to have done nothing in 30 years is ridiculous. Because right in 1994, I was part of the strategic management teams in the transition of many of our public health services in South Africa. We identified this as an issue in 1994 that had to be set up, and it can only be set up by national government. And national government wants to implement NHI, but it doesn't actually do the basics. It doesn't solve these basic problems. The second issue is that in the management of public resources, we cannot allow this level of systemic corruption to continue. Provinces like Gauteng sit with about 2.5 to 3% of their total budget on irregular expenditure every year. That's around about sort of 3.5 to 4 billion rands worth of potentially corrupt transactions. That's a resource loss to the public health system. Nothing is being done about it because if you look over 10 years, there's no change to the pattern. So all of this is indicative of the fact that government basically is not managing even the resources that it has properly, let alone trying to manage the sort of resource patterns within the region.
Yeah.
We have to have an arrangement for the region. We cannot assume that we can control everybody walking across our borders. We can't. So what's the next best option? That's the problem solving that governments are meant to be involved in. And if they're not doing it, if the people aren't capable of doing it, they mustn't be there.
Prof, I'm afraid that's all we have time for. Thank you very much indeed, Professor Alex van der Heever from the Wits School of Governance, helping us unpack the complexities around access to public health care for foreign nationals in South Africa and what it means for the country's healthcare system and, of course, constitutional obligations.